development and standardization of Arabic version of BKB test, which is it is a part of MS thesis for Dr. Ghada Amer under the supervision of Professor Inas Kulkela and Professor Dr. Trandil Al-Mahallawi. BKB is one of the speech and noise tests which consists of sentences which are approximately first grade reading level in background noise with a descending paradigm, 3 dB decrement, and scored in terms of signal to noise ratio. Test can directly address the most common complaints that the patient with hearing loss has, which is inability to hear in background noise. Although there is a lot of speech and noise tests, BKB is the only suitable one for children above 5 years or adults having hearing loss. It can be performed aided or unaided with cochlear implant. We designed this work aiming to develop and standardize the Arabic version of the BKB, which pass into through 4 phases: development of the sentences, then forming the list, selecting the signal to noise ratio, starting level, then provide age-dependent normative data. After acceptance of the ethics committee of Tanta University and after direct communication with Kilon. 54 normal hearing children undergo this evaluation, aged from 5 to 18 years. Step 1, forming the sentences, then recording it and performing a pilot study. The development sentences were short and highly redundant, rich in semantic and syntactic. The vocabulary and grammar are familiar to the children at approximately first grade reading level. Length was from 3 to 5 words. Each sentence contained 3 to 4 keywords according to their frequency. Now we have 309 sentences were finally selected. After forming it, we recorded it by native Arabic male speaker and record the noise, forming a sentences bubble communication, then performing the pilot study by introducing these 309 sentences at a level of 70 dBHL to 10 normal hearing children at 4 signal to noise ratio. Revealed that -7 was not very difficult like the English, but +8 was very easy, so we excluded in the further steps. For developing the sentence with each phase 1, we normalize this sentence by applying it to 15 children as these 3 signal to noise ratio and calculating the SNR value by the formula presented in the manual. It was -5.5. Then we pass through phase 2 for sentence selection and construction of the list according to the criteria present in the manual again. Now we have 105 sentences. For forming the list, the equivalence criteria was that the average value of each list could not deviate from the all list grand average value by more than 1 dB. So we have now 18 lists. Each one consists of 8 sentences, consists of 3 to 5 words. Each one contains 3 keywords, except of the first one contain 4 words. For step 3, selection the signal to noise ratio. By determining the signal to noise ratio starting level, it is the lowest signal to noise ratio with 100 word recognition score. By beginning to represent it from -2 dB signal to noise ratio up to 22 dB signal to noise ratio in 3 dB steps decrement. 13 was the lowest signal to noise ratio with 100 word recognition. Now we have all the list. We have the starting signal to noise ratio. We can apply it in norm to provide age-dependent normative data, aiming for application 8. By applying it onto 15, again, a new 15 children divided into 3 groups from 5 to 7, from 7 to 8, and from 8 to 14, having the normative data, which is +4.1 for the first group from 5 to 7 years, -1.5 for the second group from 7 to 10, and -3.3 for the third group. And this individual result of each of the 15 children. A ANOVA test was done to compare if we can use one list or two or three revealed no statistically significant difference, so we can apply only one list. In summary, we developed the list. All lists are equivalent. Single list is sufficient to obtain accurate SN or loss accuracy score. And we concluded that Arabic PKB test can be used as a reliable and valid test for measuring signal-to-noise ratio loss in children. The test is quick and easy, and we provide age-related norms for children. Now, in Tanta University, you have the current study by applying PKB to evaluate speech noise function in cochlear implant user, and applying the Arabic PKB test on a large testing sample group for sensory neural hearing loss. Thank you.